Other things. So user groups deal with the determinants of health, which is also not really well understood. And that's that if you get poor treatment by police, or you ever go to a prison, or that you're not getting access to housing and income, those are the things that really destroy your health more than you know, whether you can get a vaccine, or whether, you know, you can go to the hospital when your liver fails. That's not a good place to put the fence at the bottom of the cliff. You want to put the fence at the top of the cliff. So that you provide support, education, and empowerment to users, and there's no clienthood. So this is the main difference, and it's very poorly understood, because some drug user groups do want to become the people in charge, and they treat the other drug users in their groups as clients. And this is a model that's adopted elsewhere. But if you try and do this at VANDU, you'll have to run for your life, because they won't put up with it. Anyway, so the other thing was the more subtle parts of pride, camaraderie, a place to belong, and volunteer and career opportunities. The thing that drug user groups can do that service providers don't do, right, is they'll do these protest rallies, and it makes a huge difference. And we're much more effective at creating policy change than straight people who are worried about getting their funding cut. And believe me, the injection support term is civil disobedience. So people who can't inject them themselves, we checked the numbers, and VIDUS, the Vancouver Injection Drug User Study, says that anyone who has, this is the question, have you had to ask someone to help you inject in the last 6 months, at least once? For those people who have had to ask in the last 6 months, their AIDS rate is way higher than anyone else's. It's like 80% positive. So people who wander into an alley with a dope in one hand and a needle in the other and go, can someone help me inject? Are extremely vulnerable, and that's why the AIDS rates are so high amongst that group. So VANDU was onto this, and we knew they couldn't get into Insite, so we started an injection support team. And the trivial quiz is, how many laws do you break when you inject another person with drugs? Maybe 4 or 5, I'm not sure now. Anyway, people do it anyway, and what we were trying to do is organize the people who are known as doctors in the community so that they were trained. They have phone, they know how to deal with an overdose, they knew all about how to make sure that it was a clean injection that they were participating in, and then some of the other rules to make sure you don't actually kill somebody. And you know what I mean, that they know the syringe, that you know what's in the syringe, and you do it in a kind of well, anyone who doctors people does it in a friendly way. So, and so we have an unsanctioned injection and inhalation room in the VANDU office right now, so that people aren't forced to use their drugs unsafely in alleys, and we have a team of people who are trained to assist with injection. Within about 6 months, there's going to be a public paper. A paper is going to be published in a scientific journal about our injection room, because someone came in and interviewed people there and said, why do you use this room when you could go down to Insite? So we've got those answers. Yeah, there is lots of reasons, and so I just want to say, if you're doing the legal stuff, it's really, really good to team up with some researchers who can keep perfect track of what you're doing, I guess, in preparation for your court date, if you can ever get such a thing. And what we found is, in fact, that they really avoid arresting you, and they'll pretty much do anything else. If we don't root this movement in a social justice issue, we will end up with the kind of social justice that people involved in the mental health system ended up getting, which I don't think is very good. So if you like it, go look and see, but it's very loaded up with service provision. There's not very many rights for the people involved, and there tends to be even a stripping of people's rights. I mean, I don't know if there was ever a time when you were just allowed to be crazy, but what people want to be able to do is be able to be a person who uses drugs. And there's, of course, so anyway, this is some of the stuff from the VANDU manifesto. Who's got it? It's yellow. And these are quotes from there. So some of the really significant parts were the right to obtain, prepare, and ingest drugs, and to be intoxicated on drugs according to our own personal decisions, without criminalization or unsought interference from individuals or organizations, as long as our drug use does not directly harm other people. And when people have trouble with this sentence, because it is a bit weird, just substitute wine. So you say the right to obtain, prepare, and ingest wine, and to be intoxicated on wine according to our own personal decisions. It seems perfectly palatable that your second glass of wine, which gives you a little buzz, is legal, and that you have the right to ingest that. So if this kind of makes you feel uncomfortable, that you shouldn't be asking for the right to ingest drugs, just substitute wine and you'll feel good about it. cover-up, and VANDU was we sued the Federal Minister of Health and the Attorney General. And that was around Insite. We asked for we wanted to challenge the drug laws directly, and our case got dropped and it got folded into the Insite case. So they would not examine the drug laws in the Insite case, partly because Portland didn't force them to. We kept saying to Portland's lawyer, if you do what we do, they will have to examine the drug laws. And the Portland said, no, we don't want to examine the drug laws, we just want to win. And they did win, and it was a good thing, but it's an interesting, that's again, when you're working with your allies to say they can actually weaken your case by not having everyone singing from the same songbook. The Insite case is based on this sentence. So we all thought we would lose the Insite case. It was like a Morgan there. There's a super conservative judge, there's 6 or 8 lawyers for the government, and our 3 volunteer lawyers on our side that aren't even being paid, you know, it's kind of hunkered down. And then,
intimidation.
no, this is a big trial. This is where Pitfield, the judge's name was Pitfield, and he actually found in favor of keeping Insite open. But I want everyone to get this into their heads why he said so. And then, you know, the way it works when you go to you get an appeal, they only look at the original decision. They don't do more stuff, but each time you get to put more evidence in. Especially if you're the ones who won, you get to put more evidence in to even bolster your case more.
And then you collect them.
You go, so, because that's what they have to consider when they appeal, is they realize that you're going to be able to put more evidence in so they can lose again. And they have. They've lost every single time they've appealed. And what stands is, there's much to be said against denying addicts healthcare services that will ameliorate the effects of their condition. Society neither condemns the individual who chose to drink or smoke to excess, nor deprives that individual of a range of healthcare services. Management of harm in those cases is accepted as a community responsibility. I cannot see any rational or logical reason why this approach should be different when dealing with narcotics. And the government kept saying, well, narcotics, that's their choice. You know, they're breaking the law and they're illegal, and this is a reason to deny them health care. So what you get from this, and this is the thing you can keep explaining to people, is the reason you're going to provide health care to people who are using illegal drugs is because we don't, you know, people who overeat, people who destroy their health in many ways still get access to our healthcare system. Yeah, and so this is a very, very conservative judge, and he just sees the logic. So he's sticking with logic here, which made us, that's why we won. So it's Justice Pitfield, who is now retired, but it's amazing and that reasoning's easy to understand, I think. And that's, everyone goes, you know, it was seen as a federal thing or a provincial thing, and there's all these really stupid technical arguments. But the easiest thing to tell your friends and neighbors and mom and dad if they want to know why Insite won, it's because you can't deny health care to a certain group of people any more than you can to another group of people just because other people view it as self-destructive, like smoking and drinking is.